Well, welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic is ketamine, a very important and new breakthrough. I shouldn't say new breakthrough, kind of a new discovery to a lot of people to help with a number of different conditions, pain, anxiety, PTS. I'm not an expert on it, but we do have an expert that's going to help explain exactly what it is and how it works. I'd like to, first of all, welcome each of you for coming. This is the last of our series of medical marijuana and wellness webinar series. We are going to be having another series starting next quarter. It'll start January 12th, and within about another week, we'll be posting the schedule for next quarter. And thank you all for showing up tonight. To start off, I'd like to welcome Turner Davis. Turner has a ketamine clinic that's in Tallahassee, and he'll be explaining what ketamine is and how it works. So Turner, welcome.
I appreciate it, Marc. I appreciate the opportunity to talk about.
Good. Turner, tell us a little bit about yourself.
Yeah, so I have been, I'm a pharmacist, graduated pharmacy school back in 1998. I've done all sorts of different pharmacy tasks throughout my career, from, retail, normal CVS, Walgreens type stuff, to home infusion, to now sort of specializing in medical marijuana and education on that piece, working with doctors to get patients in Florida their cards. And, that sort of alternative pathway to health sort of led us into looking into ketamine for those patients who may not respond well to traditional treatments. We have a lot of medical marijuana patients who have depression, long-term depression, long-term PTSD, chronic pain, those sorts of things. And while the medical marijuana can help, helps a vast majority, and a lot of them really, respond better on the medical marijuana than they do to some of the more traditional pharmaceuticals, especially from a side effect profile. Not all of them respond in the way that, they're looking for. So, for a next step, or for someone who has failed other types of therapies, ketamine infusion therapy can really be a good alternative. And that's sort of where we picked up the ball on that side of it. And been doing that now for about 4 or 5 months. And ketamine itself, as a therapy for depression and chronic pain, has been around for about 10 years or so. So really excited to talk about, the possibilities and to address those patients who may think it's a good alternative for them. So.
Right, and you might want to point out that ketamine has been used, especially by the military, for quite some time, more than 10 years.
Oh yeah, no, ketamine itself has been around since the 60s, was FDA approved in the 1970s as a surgical anesthetic. But more recently, it's been really studied for its effect on treatment-resistant depression, PTSD, and again, those sorts of chronic conditions, especially neurological conditions, that haven't responded well to traditional or other medication therapies. So, that's really kind of what I'm going to go over tonight as to what, the type of population that ketamine can help, as well as how it works, and what it takes to qualify for this type of treatment. So,
cool. Well, listen, I'm going to share one slide, and then I'll turn the slide deck over to you, Turner. But there's one slide I did want to share with everyone, and that is that let me get this shared here. This is the last of our webinar series on ketamine. I do want to point out that there's obviously a number of different ways you can access this. This webinar tonight is being live streamed on Facebook, and you'll be able to ask questions. There's a Q&A button that you'll see at the bottom of the screen that you can click on, and we'll be monitoring the Q&A. And really, this whole objective of having this webinar is to get your questions answered. I know there's a lot of people that have questions. By the way, there's no such thing as a dumb question. We're here to answer their questions and really help demystify the whole process of ketamine. I also want to point out that because we are recording the webinar, you'll get an email as a follow-up. That email will have a link to the video, which will be a YouTube video on this webinar. It'll also have the slides will be available to you. They'll be in flipbook format. We'll have some discounts that are available, speaker information, and then of course some of the resources we use to put this together. So I know sometimes these presentations are like drinking water out of a fire hose and you're trying to take notes. It's kind of hard. So you will be getting the information. You will be able to review it. And more importantly, if you want to pass it on to other folks, please do. So I'm going to stop sharing my screen, Turner. And why don't you share yours and tell us a little bit about ketamine?
Let me get this presentation up and going here. Let's see. All right, can you see my screen there?
Got it.
All right, great. Yeah, so like I mentioned, we've been doing, I've been a pharmacist since the late 90s. Started working with medical marijuana in the 2012, 2013 time frame. But before that, I really had a lot of experience with infusion, with IV therapy, both in the home and in the hospital and clinic setting as a pharmacist. So when this we started to learn more about ketamine therapy, we had a couple of physicians that we work with on the medical marijuana side come to me and say, hey, I'm starting to hear more and more about this ketamine therapy. Do you think this might be a good fit for what we do? And the more I looked into it, it really did, track well with our medical marijuana therapy, as far as, patients coming to us that have tried other therapies that haven't worked very well. They're not happy with the side effect profile. They're not happy with how a lot of the pharmaceuticals make them feel, because as we know, antidepressive therapy, the tablets that we take, the Zolofts, the Celexas, there's a whole myriad of medication, the antidepressive medications, Prozacs out there that work well, but they also have their own levels of side effect, and they also don't work for everyone. The unfortunate thing is, and this goes from those traditional pharmaceutical therapies, as well as for medical marijuana, it doesn't work for everyone. So those patients who have tried those typical therapies, have tried talk therapy, have tried a lot of other things, and it just hasn't worked for them. Ketamine has really proven to work in a lot of instances where some other things didn't. So that's where we saw sort of an add-on to the service we're providing, a good fit for that particular patient population, not only for depression, PTSD, and those sorts of things, but also for chronic pain patients, those patients specifically for more neurological type pain. So for pain that is really more inflammatory in nature, you can think of knee pain or back pain, those sorts of things. Ketamine doesn't really fit that profile. Medical marijuana works well for that. But for neuropathic pain, such as fibromyalgia, for peripheral neuropathy, for those types of migraines, those types of nerve-related pain, ketamine can really help, mitigate some of that long-term chronic pain that patients deal with. So that's really kind of what I wanted to talk about tonight. Is a lot of people, this is new for a lot of people. They may have heard about it in passing. They may have seen an article here or there. But I wanted to dig a little bit deeper into it tonight, just to sort of give everybody an idea of what it looks like and how it can really help patients that are looking for, another alternative for those types of chronic conditions. So, let's talk about, ketamine specifically. We've all probably heard the word or know of the drug, out there. It's been around for like we mentioned, a long time. First used in 1962, the U.S. military was actually looking for an anesthetic that had a better side effect profile than some of those on the market. The Vietnam War is really where ketamine use sort of came to large use. It's a synthetic medication, so it's actually made in a lab. It doesn't come from a plant or those sorts of things. It was specifically tailored to have an anesthetic effect in humans. FDA looked at this and approved it in 1970, and it's really been in widespread use in surgical settings ever since then. But what's unique about ketamine when you compare it to some other medications, and specifically some other anesthetic medications that may be on the market, is it has multiple functions within the body. It actually works as a hypnotic, an amnesic, and an analgesic. Has all three of those effects within the body, which really gives it a unique clinical profile that a lot of other medications. It's really unique in the fact that it's the only medication that has those specific sorts of effects within the human body. Again, like we mentioned, it's been used for over 50 years. But what really, when we start looking at ketamine outside of the surgical setting, outside of the anesthetic setting, we can really start to look around the mid 2000s, where it was noticed that people that may have a surgical procedure, all of a sudden, if they suffer from depression, they would come out of that surgical procedure and have a lot better outlook on life for a few weeks or even months. And that started to become something that was very, very common, and doctors and researchers started to notice that, hey, we're giving these patients this anesthetic for this one procedure, and they're coming out feeling a lot better from their chronic depression or chronic pain on the other side than we would expect them to, essentially. So that's really when the research started being done, in the mid 90s. And then in 2006, the Journal of the American Medical Association published a paper that has really become sort of the cornerstone of theory behind this ketamine for treatment-resistant depression and some other conditions. And the fact that they really found that treating someone with a treatment-resistant depression patient with ketamine therapy, they saw a rapid response, and they saw a response that lasted weeks to months for those patients. So, that's really where that started to take off, and where this off-label use, ketamine is still not approved in its infusion form, in its typical traditional form for depression therapy. So it's really off-label use that physicians use it for depression treatment and for chronic pain. But it's really proved to be a very effective medication for those patients, again, PTSD, anxiety, chronic pain, and migraine headaches. So currently today, as it's evolved, ketamine therapy is available through several routes of administration. So you can receive ketamine injections through the IM route, which is just a traditional shot like we're used to, a sublingual troche, which is actually a tablet that you dissolve under your tongue. There's actually an FDA-approved nasal spray on the market now, S-ketamine, that has been prescribed for treatment-resistant depression, and is an FDA-approved drug for that, which shows you again the effectiveness of ketamine in the depression treatment sphere there. That the FDA has actually approved this drug now for specifically the use in depression, and then again intravenous therapy. So when we look at the effectiveness of the routes of administration, we have intravenous has been proven to be much more effective than injection, much more effective than nasal spray. And then finally, the sublingual oral route of administration is the least effective. And this has to do with the bioavailability of the drug. It was always designed as an intravenous drug to be used intravenously. So it is much more bioavailable through the IV route. The nasal spray that the FDA approved, the reason that got a approval as a new drug is because that route of administration as a nasal spray was new. It's only available in specific settings. It has to be dispensed by a doctor who has a special license to dispense this ketamine as a nasal spray. But more and more studies have shown that really it's an easier route to use, of course, than an intravenous route. It can be used every day, but the overall effectiveness is not really quite there as much as the intravenous and injection routes may be, even though it may be more convenient. So that is something to consider there when you're looking at which route of administration would I like to use.
Now, Turner, in your clinic, you do all four. Is that correct?
Well, now in our clinic, we really focus on the intravenous route. We focus on the intravenous route accompanied with talk therapy and with a follow-up with a therapist, because honestly, that's really where the sweet spot is for those long-term depression sufferers, for those patients who may have a hard time or have failed other therapies. The ketamine really works well to sort of boost your mood, to improve depression, to improve the symptoms of PTSD, but it works a lot better when you accompany it with the talk therapy piece of it. So, we focus on, we do and I'll talk about this later in the presentation, but we do an initial assessment to see if you're appropriate for IV ketamine infusions. And then we follow up after the infusion. Our therapist follows up and says, with how are you doing, making sure you're responding well, making sure that that effect of the ketamine infusions really is carrying on beyond just the initial, I feel better in the clinic and then I go home and I don't feel better. We want a long-term effect. We want an effect that, really use this as a program more than just a service of, okay, I got my IV ketamine and I go home. We want to make sure our patients are improving as much as they can over the period of time here. So yeah, we really
that's an important point. What you're trying to do, which I think is, it's not just take it and we'll see you later. You want to really make it a personal experience for the patient to make sure that it is in fact effective and working.
No, that's exactly right. I mean, that's really shown to be the most effective way to address these longstanding conditions. Again, uh, although the ketamine, IV ketamine therapy can really have, patients that haven't responded to anything else may respond to the ketamine therapy, but it really is much more effective when you accompany that with follow-up with talk therapy with a therapist to really maintain that effect long term, and that's really what we shoot for. So we really kind of substitute the the effectiveness of the intravenous therapy that we know works in upwards of 70 to 80% of patients with talk therapy and with booster infusions over the course of a year, rather than a daily dosing regimen like a nasal spray or sublingual, which may or may not be quite as effective in the long term. So, there's different theories about it, but really the research has shown, again, the much more effectiveness with the intravenous route and combining that with the talk therapy, which is, we really focused on using the most effective way to treat these long-standing conditions rather than the most convenient way, which is what the nasal spray and the sublingual may provide, even though it may not be the most effective. Ketamine infusion therapy, we talk about this again, studies, again, shown low doses of ketamine infused over 1 to 4 hours can improve a lot of conditions that may not respond to standard therapies. Ketamine therapy is not your first choice. You don't seek out the ketamine infusion clinic when you just feel sad for a day, or just when, you may have a little bit of a flare up from an occasional neuropathic condition. These are conditions that have been long-standing that haven't responded to other therapies, that are really the best cases or best candidates for ketamine infusion therapy. Now, the doses that we use are about 25% of those that would be used for surgical anesthesia. So it's a very low dose of ketamine infused over a longer period of time than you would typically for a surgical procedure, and it doesn't put a patient all the way under. We're looking for a dissociative effect, a slightly sedative effect, where the patient's still conscious, patient can still talk, but is relaxed and is letting the medicine do its work on the nervous system. The goal is relaxation and mild dissociation under medical supervision. Again, a lot of work has been done really for depression and PTSD, anxiety, those sorts of conditions. And for depression and PTSD specifically, ketamine, what's amazing is it works incredibly fast. We've had patients that have suffered for years with depression and PTSD with very little response, feel better within hours after receiving their first ketamine infusion. It works differently than traditional antidepressants in that it has much more of a direct effect on the nervous system, on the brain, in particular, the NMDA receptors. It immediately affects those parts of the brain that cause depression, and has, again, a long-standing effect, especially when we complete the induction series and we go into a maintenance phase. And when I say induction series for ketamine infusion, typically for mental health conditions, a patient will receive 6 1-hour infusions over about 3 to 5 weeks. And then they move into a maintenance schedule of about 1 per month or as needed. So we stay in contact with the patient, and the patients tell us once they complete that initial series of 6 infusions, if they need another one. We track mood scores, we track scales of depression for patients moving forward. We monitor that on, we have a computerized EMR system that tracks those scales. If a patient we see their mood scores start to slip, we'll reach out to them and say, hey, do you feel like you needed a booster? We're seeing your mood score slip a little bit. We're seeing some of those other GAD-7 scores or whatever they may be, those scales slip a little bit, or reach out to those patients and say, hey, it may be time for you to come in for another booster. Typically, patients after the first 6 infusions will receive somewhere between 4 to 6 infusions more that year. So it's not something necessarily that most patients do every month or every week. It's usually every other month, but maintaining that occasional infusion series really does maintain the effect over a longer period of time. And studies have shown what's remarkable, even though a patient may have failed other types of therapies, Ketamine infusion therapy shows response in 70% of treatment-resistant depression patients and over 80% of PTSD patients. So it is very effective for those who may have failed other types of treatment. So how does it work? It sounds great. Why is ketamine different than Zoloft or Prozac or those sorts of things? It works, ketamine works in a very unique way compared to other medications. So ketamine works specifically on what we call NMDA receptors. NMDA receptors are critical in the brain and the nervous system for pain regulation and also for memory function in the brain. And so I have this chart here, I know this looks really complicated, but what's unique about ketamine is that it has anti-inflammatory effects. It can work very similar to SSRIs and those sorts of traditional anti-inflammatories, and the fact that it boosts your mood short term. But one of the most unique things about ketamine is that it has, with the effect that it has on the NMDA receptors, it actually boosts something called brain-derived neurotrophic factor, which actually makes new nerve connections grow within the brain. So not only is ketamine relieving longstanding depression by boosting, your existing neurotransmitters that may help relieve depression, but it also helps your brain reroute around those nerves that are hypersensitive to trauma or hypersensitive to those memories that may cause depression over a long period of time. It helps your brain remap itself. It helps your neurons remap themselves to go around those receptors or those nerves that may be sensitized to depression or sensitized to PTSD or anxiety or those things. So it really is a very unique, when we talk about the long-term effects of ketamine, that's really where it shines, in the fact that it can help the brain sort of reprogram itself to perform better, to function better, to get around those areas that may not be functioning well and causing depression or anxiety or those sorts of things that have been long-standing issues. Just like depression and PTSD don't pop up overnight, it's hard to treat them overnight, and it's hard to, you really have to. What ketamine does is help the brain, those connections that are formed over a long period of time, find new routes to get around those long-standing issues. And it's a very unique medication in the fact that it can do that. When we talk about, I mentioned those 6 infusions that we start off with initially. Evidence has shown, has looked at single infusions and multiple doses, and compared the two. And you can see here by this chart the dose response really over time. So we talk about, giving, typically what we'll do, our induction series of infusion for mental health, we'll give 2 infusions the first week, 2 infusions the second week, 1 infusion the 4th week, and then 1 infusion on week 6. And you can see how when we spread these out, the patients respond. They start off with 40 to 60%, but by the time we get to infusion 6, we're upwards of 70 to 100% of patients get some response, get some benefit from that induction series. And then it's just about maintaining the effect and maintaining the benefit that those patients.
Now you're talking about the techniques that you use, which is the infusion method.
Mm-hmm.
Right.
Correct. Yes.
This is the sprays and the sublinguals. That's a whole nother chart.
Yeah, exactly. Well, yeah, sprays and sublinguals. Yeah, we don't actually provide that service, just because, again, that's an everyday. So sprays and sublingual, you're talking about an everyday treatment. You're getting very minimal absorption from those things, and there's really not a lot of evidence to back up. There's no to back up that the sublingual route especially is very effective over time. It's sort of a borderline benefit for the nasal spray. The FDA approved it. There is some benefit there, but it's nowhere near what we see with the infusions over time. Most of the work, most of the studies that have been done through research and doctors' offices have been done through the IV route. So that's sort of, even though it's a little more inconvenient for the patient, it's not an everyday dose. You limit the daily side effects of ketamine that can occur from that dose. So we're giving 6 infusions over 6 weeks, then 1 every other month. So you don't have to deal with ketamine side effects every single day, and you still get the benefit over time of the ketamine as a medication. So that's really the one of the big benefits of that is to avoid those side effects every day. So I've got a video here, and let me see. I'll have to share my sound here. So this is a good video, just briefly. It's about a 2 or 3 minute video, but this is a good description of a typical ketamine patient experience and what they experience while they're getting that ketamine therapy over an hour to 2 hours, either for mental health conditions or chronic pain. So I'm gonna go ahead and play this so everybody can kind of get a good idea of what ketamine therapy looks like in the real world.
It looks like a spa.
Alexa, play meditation music.
A place Rachel Bush has gone to unwind.
Is the music loud enough?
It's loud enough.
But this is a medical procedure where Rachel is being treated for PTSD, depression, and anxiety with an injection of ketamine.
The past few months were rough.
After an assault that nearly killed her, she was prescribed antidepressants that just didn't work.
I was contemplating suicide, wishing that I had been finished off.
Then someone told her about Dr. Quan Henderson, owner of Mindscape Ketamine and Infusion Therapy.
It kind of helps kind of remodel the brain, the way it feels about certain things.
Ketamine affects your brain's neurotransmitter called glutamate. You can liken it to how Zoloft affects the neurotransmitter serotonin. Ketamine often gets a bad rap because of its history with people abusing it. Its street name is Special K, but it's been used in medicine for decades.
Ketamine is an anesthetic that's been around for 50 years, but in the last 15 years it's actually been used for treatment of mood disorders that are resistant to certain medications.
Dr. Henderson opened this practice after ketamine helped his wife, Stacy, who'd battled depression for years.
I couldn't believe it. It was just such a wonderful, life-changing experience for me.
KHOU's mental health and wellness expert Bill Prasad warns ketamine has addictive properties, although it's on the lower end of the spectrum. He says ketamine should be used sparingly and hand in hand with therapy. The FDA has not approved injecting ketamine for mood disorders, but the VA hospital does use it to treat PTSD and reports positive and immediate outcomes.
This is a miracle medicine.
Rachel says it worked on day one for her and describes the experience like this.
It's almost like I'm slipping away into a good dream. And things just start to make sense. Something changes. You see that you're not in crisis mode. You see the light.
Dr. Henderson says the effects can last months to years, depending on the person.
In my opinion, it's a cure for depression and PTSD.
So, as you just saw in the video there, certainly we don't want to oversell it as a cure for depression and PTSD, but some patients experience that with having ketamine therapy. It really is an individual response, but again, like I said, we do see some level of response in upwards of 70 to 80% of patients. And that description she has of sort of a mild dissociative experience, a dreamlike state, is sort of where we want, the sweet spot of where IV therapy, the goal that we're looking for. So, you're in a nice relaxing room in a nice relaxing chair for an hour to 2 hours. We tell patients to bring their favorite music, those sorts of things to really, it's really about turning your mind off, letting the medication, take its course, and you really, patients benefit on long term from those short term 1 hour treatments like that. So it really is remarkable what it can do for a lot of patients. So that's the mental health side. I want to touch on the chronic pain side here. So there's not as strong of evidence of ketamine therapy in chronic pain. The response rate is more around 50% for patients with chronic pain, just because it's a different pathway, it's a different physiological response than mental health, than depression and PTSD. But again, for those patients who have failed lots of other therapies, especially for those tough to treat neurological pain conditions, it can be a great benefit. There is some evidence of a dose response relationship. So that means the higher the dose, the more ketamine someone receives, the more effective it may be for pain. So that's why instead of a 1-hour treatment, our patients receive 2-hour treatments for neuropathic pain. Typically, pain patients have to have booster infusions more often. So our induction series for pain is 3 2-hour infusions as close together as possible. So typically over 1 to 2 weeks, you get 3 2-hour infusions. And then a patient may come in every month for a booster infusion to really kind of manage that pain. Again, it is inconvenient, obviously, more so than taking a pill at home to come in and spend 2 hours in the clinic. But again, this is a therapy for those patients who have not responded to anything else. We were treating conditions that have really been lingering and been hard to treat for a long, long time. Chronic complex regional pain syndrome, fibromyalgia, persistent migraine headaches, neuropathies that are just life, that really affect your quality of life. When you get to that point, the ketamine therapy for chronic pain may be something worth trying for you to get some relief. The effect sizes again can be relatively large. Some patients, it may last up to a month. Some are more rapidly declining in effect. If you get the ketamine therapy and you've gotten the first 3 infusions, and 2 weeks later your pain is just as bad as it was before you got those infusions, then ketamine may not be a good long-term solution for you. But if you've gotten those 3 initial infusions and it's 2 months later and you're 50 to 60% better than you were, then yeah, ketamine that's a good goal for a lot of chronic pain patients to get that 50 to 60% improvement, to improve their quality of life, to do things they may not have been comfortable doing before from a pain level perspective. So like I said, three total 2-hour infusions over 7 to 10 days. And then, 1 infusion every 1 to 3 months is needed. So for pain, again, ketamine's still working on those NMDA receptors. NMDA and glutamate play a very important role in pain sensation, especially from a neuropathic perspective in the body. And we're really doing the same thing here as we're doing with the mental health treatment, and the fact that we're trying to reset the pain receptors. We're trying to remodel the brain to sort of go around those areas that may be causing the consistent pain, those nerves that may be sensitized to respond. What happens with chronic pain over a long period of time is that your nerves get overactive. Those nerves that fire off pain signals just become hypersensitized, and it takes very little to stimulate them. So by using the ketamine, we can potentially reset that and make that pain threshold a lot higher than it would have been without the ketamine treatment. And that's really sort of the goal there. You want to inhibit those nerves that cause pain signals. There's been some evidence that the part of the brain that works in that stays awake while you're asleep plays a big role in chronic neuropathic pain, like fibromyalgia and those sorts of things. And ketamine works well to sort of, again, remodel and remap the brain to reset those areas of the brain that may just be overactive and over hyperactive and over functioning there. So, that's really sort of the theory behind it. So the question we get, a lot of times, after we talk about this, it sounds great. So how do I start? If I'm interested in ketamine therapy, I've been on, a litany of antidepressants. I've been on Lyrica and gabapentin and all these things for years, and I'm still hurting. I'm interested in trying something else. How do I start? So the first thing you would do is you would contact us for an initial assessment. So we have a therapist on staff that will contact the patient and do an initial workup to see if you're a good candidate for ketamine therapy. There's some conditions that are not good candidates. There's some sociological conditions that are not good candidates, and our therapist will help kind of identify that and see if you're a good candidate for treatment or not. That's a free service with us. Our therapist does that at no charge to the patient to make sure that you're a good candidate. At that point, if the therapist says, okay, yes, I think this patient is a good candidate, I think he'd be a good fit, then we'll contact your primary care physician for medical records so our doctor can look at those. And if our doctor's okay with everything, he'll look at the initial assessment from the therapist, he'll look at your medical records, and then we'll schedule you for an appointment for ketamine infusion. On the day you come in, we're going to ask that you hold any medications that you can for at least 12 hours, no food for at least 4 hours before you come in or drink. Again, like I mentioned, you're going to ask that you bring your favorite music or anything you need to relax, a blanket or pillow or anything you might like. So then you'll get your 1 to 2 hour infusion. The doctor will keep you in the building for 20 to 30 minutes. We do ask that patients have transportation home. We won't allow a patient to drive themselves home. So whether it be a medical transport or a taxi or a loved one, someone needs to drive them home. And then you really won't be able to drive for 24 hours. We don't advise that you drive for 24 hours after the treatment. So, again, it's an inconvenience for the first, especially the induction series. So for, your mental health, you're going to get 6 infusions over 6 weeks. So those first 2 weeks, you're going to get 2 infusions a week. And then 1 infusion on week 3, 4 rather, and then 1 infusion on week 6. But after that, it's really only once a month, and it's easy to schedule. So, again, it's really just an inconvenience for those first that induction series, and then it's pretty easy to manage for most people. And we will help patients obtain medical records. We'll help patients arrange transport, whatever they need for those sorts of things. So that's all part of the
Turner, it is a bit of an inconvenience, but on the other side of the coin, the benefits that you get from it are well worth it.
Oh yeah, no, absolutely. I mean, it's when I say inconvenience, when you compare that to longstanding non-responsive depression or PTSD, most patients are very excited to come in and get started. It's a very minor inconvenience for those people who have reached this level of ketamine as a last resort, or as something that they really see, as something they're wanting to try. So, and almost all of our patients, they may be a little anxious when they come in for their first infusion, but by their second and third one, they're excited to come back. It's a very positive experience for most patients when they come in and get this infusion, because it is relaxing. Our nurses do a great job. They've had a lot of experience with IVs and infusion in general. So it really is a very pleasant experience from the patient standpoint when they're getting those infusions. So there are a couple of side effects to be aware of, like with any medication. Of course, with ketamine, it's a very fast acting medication. So when we're talking about an infusion, we're only talking, once we stop that infusion and turn that pump off, the effect goes away in 5 to 10 minutes. The clinical effect, patients immediately start to come back out of that dreamlike state, that dissociative state that we're talking about here. So it is very short acting, but while you're receiving the medication, some nausea is the biggest issue that some patients will have. So we do provide medication within the IV to prevent nausea or to help with nausea if you do experience that. Elevated blood pressure, ketamine can cause an increase in blood pressure. So we do have medication on site to help in case that does happen. It's rare, but it does happen with some patients. Excessive sedation can happen. So, that's something you're under constant medical supervision when you're getting these infusions over an hour to 2 hours. So our nurse is checking on you every 5 to 10 minutes, making sure that you're still responsive. Again, we don't want you to go all the way under. We want you to be in sort of a dreamlike state that you can still say, hey, yes, I can hear you. I can still respond. And if you get excessively sedated, all we have to do is turn that infusion off and reduce your dose and then start it again. So it is just something to manage there that our nurse is really good at. And then again, certain medications may reduce the effect of ketamine. So we know when I mentioned that we ask that you hold certain medications before your treatment, Lamictal, benzodiazepines, naloxone, those sorts of medications can actually reduce the response that some patients have. So we do ask that if you're able, that you hold those types of medications before you come in. But again, side effects resolve very quickly once we stop the infusion or change the rate of infusion, whatever the doctor may decide. So it's a very low risk from that standpoint. It's not a long-term medication that, you're going to suffer effects for days, side effects or negative effects. Once we stop the infusion, it does resolve itself pretty quickly. Unfortunately, the downside of ketamine infusion therapy currently is because it is not FDA approved. The only FDA approved route for ketamine for depression is the nasal spray, which is in itself not inexpensive. It is a name brand at this point, but because ketamine is not FDA approved for depression, most insurances won't cover it. So it is an out-of-pocket expense. Now, we do have some insurances that will cover it. For example, in Tallahassee, our local Capital Health Plan will reimburse the patients for infusion therapy. Certain Blue Cross, Blue Shield plans will reimburse patients. So how that works is, the patient pays the doctor up front, and the insurance company will reimburse the patient for whatever allowable the particular insurance company will provide. So it is getting wider and wider coverage that way, and we do work with patients. We'll provide them super bills or whatever their insurance requires to file for that reimbursement. But out of pocket, it is, you have to consider that you're using a nurse and a physician for an hour to 2 hours. So that's really what you're paying for, is that specialist or that provider time for that. So anywhere from $350 to $600 for a 1 hour infusion, $500 to $800 for a 2 to 4 hour infusion. At our clinic, we charge $400 typically for 1 hour and $600 for a 2 hour infusion. But currently, for up until January, since we're getting started, we're trying to build up a patient base. Up until January 1 of 2022, we're offering 1 hour infusions for $250 and 2 hour infusions for $350. And that will include any infusions through 2022 if you start before January 1st. So, if you start your induction series in 2021, any of the booster shots or booster infusions that you get in 2022 will be at the same rate, $250 or $350 for that. So, it's a good time to, if you're looking, it's probably the lowest price you're going to find, honestly, around for this type of therapy. So if you're looking to get started, you're interested in doing it, it may be a good time to go ahead and investigate with us to do that therapy here in Tallahassee. We only have one location at this point in time here in Tallahassee, but we are, planning on expanding around the state in 2022. But currently, we are offering that special here locally for 2021 and 2022. So like I mentioned,
we had a question on this particular issue. We should probably get it answered right now. And that is
Sure.
covered by major medical companies. And the answer probably is no, right?
Yeah, for the most part, no. Again, here and there, specific cases, certain insurances will cover it. We're starting to see locally, at least here in Tallahassee, a fair amount of insurances that we deal with locally will reimburse patients at least partially for the service. I don't know what the reimbursement rates are to the patients, but at least it will cover some of that service. But for the most part, I know Medicare wouldn't cover it. Any government, program is not going to cover it, but some commercial insurances, workers' comp, specific types, things like that will cover the service. A lot of times it just takes a little bit of work to get it covered. So, again, I mentioned the pricing for New Horizon, our local clinic here. We also have the therapists on staff. It really is important. I can't stress this enough to, we sort of take the same route with our medical marijuana physicians as well. Education, support, therapy, support after the fact, not just here's your medical marijuana card or here's your infusion, now go home and never talk to us again. That's really not what we want. We want to have your healthcare professional as a part of your team. You get the infusion, our therapist follows up with you, you fill out the online scales and surveys to make sure that you're responding well to it. All of that plays a very important part in getting the best outcomes possible, no matter what the treatment is. And especially for these specialized types of treatment, it is important that you sort of maintain contact and take advantage of everything that you can to get the maximum benefit out of the treatment. Again, we have a specialized software that gives you the tools to communicate with us online. We have an app that you can download on your phone once you get once you become a patient, that you can fill out these mood scores and surveys as you go forward to make sure we can monitor your progress appropriately. So really, as far as my side goes, that's all it is. It's pretty simple, when you think about it. It really is. It's one medication. The only thing that varies is the doses that you get depending on your weight and the length of time that you receive an infusion, and then how proactive you are in managing and participating in your own recovery as far as the therapy goes, as far as filling out the mood scores and scales, really will determine how effective long-term the therapy can be for you. So,
Turner, we have some questions. Why don't we jump into those?
sure, yeah, absolutely.
You want to grab them? I mean, Kathy had a
Yeah,
question.
yeah. So
About
I'll start here. Yeah, I've got one. These are, this first one's here very typical of what we hear a lot. My 28-year-old profoundly depressed, started ketamine therapy last week. How long does it take before she feels better? So typically, if she's had 4 sessions, that would sort of be the cutoff point that we would re-examine. Okay, hey, if the patient's not feeling any better after 4 infusions, we'll typically re-examine. Hey, this may not be a responder to ketamine therapy. If she's had any response at all, then it's probably worth doing infusion 5 and 6, because it is. What's odd about ketamine therapy, again, it's very individualized as how patients respond. We have some patients respond after infusion 1. Some patients will get to infusion 4, like you're mentioning, feel a little bit better, and then have infusion 5, and oh my goodness, then that was the key, But if she's not responding at all, if she's not had any improvement in mood, or doesn't feel like a ketamine therapy is working at all after 4 doses, she may be a non-responder, and that's something you probably should talk to the physician about. Saying
also, there's a factor here that she's had 4 sessions in said the last week. You were talking about 2 sessions, and then
typically, typically most most of the protocols that we see spread out the sessions a little more than that. So 2 1 week, 2 the next week, skip a week, then 1, skip a week, then 2. So if she's had 4 sessions in 1 week and she's still not feeling any better, that would lead me to believe, even more so, she may be a non-responder, and that you should definitely contact the physician on that to make sure, get their opinion on that, because the more infusions you get in a short period of time, typically the more ketamine you're getting in a shorter period of time, you should feel some response there for that, after that type of treatment. So again, I would definitely, if you've reached infusion 4, you're not getting any response, that's definitely time to have a conversation with the doctor saying, hey, do you think this is working? What's your guidance here? Typically, if a patient comes to us after 4 infusions saying, it's just not working for me, we'll probably stop it at that point, saying you're more than likely a non-responder, unfortunately. Fall into that 30%. Again, it's 70%, so 30% is not going to respond. So it is not something, just like any medication, that's going to work for every single person. Just something to keep in mind there. So long-term and bad fibromyalgia doesn't work well for that. Yeah, fibromyalgia, again, there's fibromyalgia is a very complex disorder in the fact that it has a lot of mental health components, a lot of neurological pain components, and ketamine works very well for fibromyalgia, specifically because it does help, again, improve mood, as well as help sort of remodel the nerves around that pain that you're experiencing. So, of all the chronic pain conditions, complex regional pain syndrome and fibromyalgia are the 2 that are the most studied with ketamine, and they have found a lot of benefit with those 2 because of the broad causes of those conditions. So. Scoliosis pain, this would be a good example of probably one it wouldn't help a lot with, because again, scoliosis pain is usually more inflammatory, usually more structural than neurological. So although it may help relieve the pain some, I don't know that it would be a primary benefit in scoliosis as much as it would in something like fibromyalgia or neuropathy or something like that. It does have some anti-inflammatory effects, but it's not something that arthritis or scoliosis or something structural like that that it would be a primary use for sure. Do you treat 18-year-old patients? In specific instances, we try to treat patients over 21, but we will treat an adult if they're 18 and they have and we can talk to their primary psychiatrist or therapist if they've had treatment in the past. So it's not something, it's a case-by-case basis. We would have to look at the records on that, but it's not something that we would automatically say no to. If someone takes lamotrigine and has chronic depression, can you use ketamine without adverse effects? Yes, you can. Again, the lamotrigine would be something that's not going to cause a harmful reaction with ketamine. It will just potentially reduce the effectiveness of ketamine. So that's why if it's possible to hold the lamotrigine, within 24 hours of getting ketamine therapy, it shouldn't be an issue. It's just something that, and it's not definitive science, because ketamine therapy like this is still new. It's just one of those things that there is some evidence that shows that lamotrigine may reduce the effectiveness of ketamine, but again, it's just about holding it before the treatment to let it have the best chance of working. But there is no direct interaction. It's just more of a blunting the effect of ketamine potentially that we would have to work with. Ketamine for anxiety, what we found, most studies have found on that, not quite as effective as depression or PTSD, more of about a 50% effectiveness rate for anxiety. So, it may, if you've tried everything else and the anxiety is still an issue, you haven't responded well to it, the ketamine therapy may be something that would benefit you. But again, that would be something the therapist and the physician would have to look at your records and determine whether or not you would be a good candidate for that. But it is a little bit lower incidence of benefit than depression or PTSD for sure. So yeah, so those are the.
There's one about guided medication. Did you see the one about Jeannie asked?
Yeah, we do not currently. We're planning on expanding services, but yeah, unfortunately, we are limited in our online or our offerings on therapy. Talk therapy is pretty much what we offer right now. We don't actually have any of the guided meditation or on-site services like that at the moment. So. Something to keep checking back with us on, but not currently.
Great. And I think the last question we had here is just for fibromyalgia. Since my daughter uses
I responded to that one. And the scoliosis was the next one. So yeah. I think we got those two. So, but yeah. So like I mentioned, we've been doing this now for about 5 or 6 months here locally. Treated 30, 40 patients so far. We went out. Our physician went out to Colorado to train with one of the doctors out there. It's really something that's been, it's really well established in other parts of the country. Just here locally in the Southeast, it's like most things, we've been a little slow to catch on medically to some of these things, but it has been well established for quite a few years in other parts of the country, and we're excited to bring it here locally. A lot of the doctors locally are very excited that we're offering the service. Again, like I mentioned, there is well-established science behind the fact that it does work very well for certain conditions. So it is exciting to be able to bring this here locally. Got one that popped up. Should my daughter not take Klonopin within 24 hours of an infusion? It all depends on what you're taking the Klonopin for. If you're epileptic or you're taking it for seizures, obviously we want to be careful with that. But if it's just for anxiety or for those sorts of things, if you're able to hold it, then yeah, we would recommend holding any benzodiazepine at least 12 to 24 hours before your infusion, because again, it can stunt the effect of the ketamine. When one of the antidotes of ketamine, like I mentioned before, if someone gets too sedated in therapy, we will actually give them a little of the benzodiazepine, midazolam specifically, which is the same type of medication Klonopin is, to bring them back out of it. So it is sort of a direct antagonist of ketamine. So as much as you can hold it, it would be possible. Yeah. So that's really.
Thank you. Great.
Yeah.
Turner, why don't you pop off of screen sharing, and we'll give me your comments.
Yeah, absolutely. Yep, I got you.
Perfect. So, final comments.
Yeah, well, again, I just appreciate everybody for listening in. Again, this is something that is new for a lot of people. It was new to me when I first started learning about it, and it's been something that's very interesting, and it's been great to see some of the patient responses that we've had. And I encourage anyone who again, thinks they're a good candidate or has tried a lot of other things and just not worked to look into it. It could very well be life-changing for you. It is life-changing for a lot of people. So.
Well, Turner, thank you very much for the information. More importantly, everybody who's watching, thank you very much for showing up. We hope you've answered your questions and enlightened you a little bit about ketamine and help you take a look at it as a potential alternative or a form that can help you move forward. We will be doing medical marijuana and wellness webinars starting January 12th. We'll be doing one on sleep. We'll be posting that schedule coming up in the next week and a half. And again, thanks everybody for showing up. Hopefully this is informative. And Turner, thanks for the information. We really appreciate it.
All right. Thank you, Mark. Thanks, guys.
Thanks, everyone. And everybody, have a great Thanksgiving holiday.